My name is Julia Worrell, and we're going to talk today about temporomandibular joint disorders. If you think that you're suffering from a temporomandibular disorder, then the following series of videos are going to be very interesting to you because we're going to talk about the condition itself and also various options that are available for management of this disorder. So the temporomandibular disorder is often incorrectly referred to as TMJ, but this disorder involves more than just the joint itself. For instance, the facial muscles that we use for chewing on the side of our face are usually deeply indicated in this condition. And then we have the jaw joint itself, and we have the ligaments that hold that jaw joint together. So there could be other conditions too and other structural aspects of our face that are involved with the temporomandibular disorder, but we will discuss those in future series of videos. Did you know that about 75% of the US population has experienced this at some point or another? The various features of temporomandibular disorders such as tenderness in the muscles, noise in the joint, maybe clicking or popping. Maybe the ligaments have been strained, but throughout our lifespan, we may have experienced this at one time or another. Most people start to have issues in their 20s, but some teenagers even complain of clicking and popping in their jaw joint. Most temporomandibular disorders are temporary in nature and fluctuate over time. I think it's important to stress that. Most temporomandibular disorders will resolve on their own with minimal attention to it. So despite the large number of people that have these symptoms, basically only about 5 to 7% of them will need to go on and have some professional care to manage. We're going to discuss through these videos a number of self-care measures that you can take to resolve your symptoms. The most common symptom people experience is pain right in front of the ear over the jaw joint, right in front there, and in the face muscles. The discomfort could be on one side or it could be on both sides. You could feel like an earache or a heaviness in your ear. You could get headache pain, or you could actually have face pain. The pain could come on quite suddenly, like after you've chewed on something hard or bit down on something hard, or you yawned. Sometimes people yawn and then they have a locking sensation in their jaw, or it could come on slowly and progress in severity over time. Your condition could become chronic if we don't intervene quickly. And so that is the focus of these videos, is to teach you how to identify an issue and then also how to intervene quickly so this does not progress to become a chronic condition. So if it does become chronic, well then you might need to address other issues either with physical therapy. You might need to see a dentist who specializes in orofacial pain that can make a splint or a dental appliance that you wear over your teeth. There might be many things that can be done for that small percentage of people who go on and can't be resolved through self-care measures. We want obviously to have the least amount of intervention, the most conservative treatment possible. So if what we describe in these videos doesn't help you, then we definitely will follow through with some advice on how to find a provider who can help you. And you really want to see somebody who specializes in this, who truly understands the complex nature of all the nerves and the muscles and the ligaments that are involved with this joint that we use more than any other joint in our body. It's a very unique joint. We use it to chew, to swallow, to talk, to smile and express ourselves. It is an amazing complex joint. But similar to other joints in our body, it responds very well to an acute injury by using the same principles that we would use for another joint, which is to rest the joint, to use ice or heat, and then also to, we can't elevate it, but we can support it. And that is what our splint, the quick splint, will do for your jaw. So we will go over some commonly asked questions. We'll address some misconceptions about temporomandibular disorders, and we will provide opportunity for you to voice your opinion on what you would like to learn more about and whether they were helpful or not. So until next time, I'm Julia Worrell, talking about temporomandibular joint disorders.